My next topic of discussion is the cranial x-rays of President Kennedy that exist today. There are only 3 extant skull x-rays. We know that 5 or 6 were taken. There are only 3 that exist today. And I mentioned earlier that all 3 of those are copy films. They're not originals. They're forged composite copy films. They're altered images. So let's examine what happened to the skull x-rays, why, and how it happened. 2 of the 3 skull x-rays were altered following the autopsy to remove evidence of exit at the rear of President Kennedy's skull. Now, 2 of the x-rays total, 2 or 3, were destroyed. They're not on the record today. On some occasions, Gerald Custer, the x-ray technician, said that 5 x-rays were taken. On some occasions, he said 6. Dr. Ebersol, the radiologist, told Dr. David Mantic in an interview that there were 6 skull x-rays exposed. This means that either 2 or 3 skull x-rays were destroyed. A minimum of 2 were destroyed. Dr. David Mantic, a radiation oncologist, an MD, and a PhD in physics, as I mentioned earlier, has visited the National Archives a total of 9 times to study primarily the JFK skull x-rays, as well as the autopsy photographs. His conclusions after his 9 visits are that the surviving 3 skull x-rays are composite copy films, forgeries, not originals. The 2 lateral skull x-rays, the side views, show an impossibly dense white patch in the right rear of the skull, obscuring the exit wound seen in both Dallas and at Bethesda Naval Hospital. The 1 AP x-ray, which is the anterior-posterior view, the x-ray beam went from the front of the skull to the rear of the skull. The AP x-ray has had an apparent bullet fragment, conveniently matching the accused assassin's weapon, superimposed on the image. Let me explain what I mean. This is an image of the right lateral skull x-ray. This is an enhanced image of the x-ray made by the HSCA staff. The reason they felt it was necessary to make an enhanced image in the first place is because the JFK skull x-rays are very unusual in appearance. They show a very high degree of contrast that is not normally seen in a skull x-ray. So they had to make an enhanced image to better study it. And instead of a blowout in the right rear of the skull, which would be evidence of missing bone behind the right ear and missing brain tissue, you see a very bright or lucent area. You can see it in this image. Now in an x-ray, light areas indicate that the x-rays pass through very dense material and couldn't quite all make it through the material. And dark areas indicates that the x-rays pass through very thin material or areas where there was just air, and that's why they're dark. Dr. Mantic used the science of optical densitometry to study the skull x-rays in the National Archives. Basically what he did was to use a device called a densitometer and study the amount of light coming through each skull x-ray at hundreds of different locations. This is a technique used in radiation oncology, which he adapted to the study of the JFK skull x-rays. And his empirical data that he gathered over his 9 visits revealed that this white patch in the rear of the skull behind the ear transmits about 1,100 times more light than the frontal region of the skull x-ray. So area F in this image is the frontal region of the right lateral skull x-ray. And the reason that it's very dark is because there was a lot of brain tissue missing in this area, and there was a lot of air in the skull at that point. That's why it's very dark. There's not a lot of tissue for the x-ray to pass through. The very dense region, the very lucent or bright region on the x-ray, which is labeled P for patch or P for posterior here. Normally that, on a normal skull x-ray, the brightest area on the skull should only emit 2 or 3 times as much light as on the darkest area on the picture. And once again, let me explain that. In a normal skull X-ray, area P should only emit, in a normal skull X-ray, first of all, you wouldn't see this high degree of contrast. It's just very unusual. It's very abnormal. And second, in a normal skull X-ray, area P, the brightest area, would only emit 2 to 3 times more light than the darkest part of that skull X-ray, which is area F in this picture. But in the JFK lateral skull X-rays, area P emits 1,100 times more light than the frontal region. Dr. Mantic has concluded that area P was created by light blasting that region when the lateral X-rays were copied. This alteration of the lateral X-rays was performed to hide the blowout in the right rear of the skull. So let me explain in layman's terms what was involved in making these altered copy films of the JFK skull X-rays. Once the authentic X-ray was developed, you had a large sheet of film with an image on it. All one had to do in those days was to go into a dark room, place a sheet of copy film underneath the developed X-ray. So you have an X-ray that's already developed, place a sheet of copy film underneath it of the same size, and then turn on the room lights for 10 to 20 seconds. So no X-rays were involved in making copy films in those days. You just turned on the ambient lights in the room. Then you turned the light off again, and you would put a mask or a template on top of the developed X-ray, leaving a hole for the area that you wanted to light blast. In this case, the area to be light blasted was the right rear of the skull, where there was a large hole seen in Dallas. So a template was placed over the top of the authentic X-ray, and then that area was light blasted. And then the copy X-ray was developed, and the original X-ray was either destroyed or suppressed. So Dr. Mantic, in a series of control experiments, has replicated this technique. He's done it himself, and this was relatively easy to do. The third skull X-ray is the AP, and you'll see that in what appears to be to the viewer, it appears to be in the orbit of the right eye, you see a large, bright object, okay? Now this is an AP X-ray. The X-ray beam went from the front of the head toward the back, and that bright object is supposed to be a bullet fragment that was shaved off and remained on the back of the head, okay? So one can see this bullet fragment on the lateral X-rays from the side, but it's very, very small and very, very thin, very minuscule. On this AP X-ray, the object is very, very bright and very, very dense. In fact, it's denser than all of President Kennedy's fillings combined. You can't see the president's dental work in these X-rays. They've been removed by the House committee. But Dr. Mantic studied the optical density of the dental amalgams, the fillings. And this bright object is more dense than all of the fillings combined when they're seen end to end in this X-ray. That's a physical impossibility, since this same object, when seen on the lateral X-rays, is trivial and insignificant in size. So Dr. Mantic's conclusion is that this object is also the product of light blasting, of alteration. This is also a copy film. It's not an authentic X-ray. And this is done to incriminate the accused assassin. The width of this fragment is 6.5 millimeters, which just happens to be the caliber of the ammunition reportedly used by the accused assassin. The important thing to remember about this is that Jeremy Gunn and I were so impressed by Dr. Mantic's research that we decided to ask the autopsy pathologists questions about this fragment at their depositions. All 3 autopsy pathologists, Dr. Humes, Dr. Boswell, and Dr. Fink, stated under oath to the review board that they do not recall seeing this bright fragment on the skull X-rays the night of the autopsy. Nor did they remove any fragment this size from the body of the president. And after all, what was the purpose of taking X-rays at the president's autopsy? The sole purpose was to find metal in the body, bullet fragments. and to allow the doctors to locate them and remove them for submission to the FBI lab for analysis. So none of the three pathologists saw this fragment when they viewed this X-ray the night of the autopsy. These statements were made under oath in 1996. And they all admitted that no fragment of this size was removed from the body. So Dr. Mantik's conclusion that this is an altered X-ray, that this is a forgery, and that this bullet fragment is the subject of light blasting has been confirmed by sworn testimony. So here's a recapitulation of what I just explained. In addition, both Dr. Humes and FBI agent Frank O'Neill both testified under oath that the two lateral X-rays, they were looking at the originals when they were under oath, looked very peculiar to them and displayed a degree of extreme contrast not seen when the films were examined during the autopsy itself. For example, this extremely dark void in the frontal region of the skull troubled both Dr. Humes and Agent O'Neill during their review board depositions. Neither man recalled seeing a skull X-ray that looked like that the night of the autopsy. My conclusion is that the high degree of contrast in the extant skull X-rays is an artifact of alteration. It's an artifact left by the forgers who did imperfect work. The longer the lights were left on during the copying process, the higher the degree of contrast. So the forgers didn't do a perfect job. And the high degree of contrast in the surviving X-rays today is proof of imperfect alteration. It's that simple. The final act of deception in the medical evidence arena was the placement of substitute brain photos in the official collection. As an aside, I'd just like to say that I believe that the brain photos in the National Archives, which cannot be and which are not images of President Kennedy's brain, are the single strongest evidence of a cover-up in the Kennedy assassination. This evidence is that important. So let me explain what the problem is here. The pattern of damage seen in the brain photographs in the archives is not consistent at all with the pattern of damage seen in Dallas, or at the autopsy for that matter. The photographs of a brain in the archives show the right cerebellum to be undamaged, completely undamaged. And the damage seen in the photographs to the top of the brain, to the cerebral cortex, appears to be generally consistent with a shot that might have been fired from behind. There's also too much mass present in the brain photographs. We'll talk more about that in just a moment. In 1996, my boss, Jeremy Gunn, asked me to conduct a timeline showing what happened to President Kennedy's brain after the autopsy on his body. I was happy to perform that study, and the results were startling. After the autopsy on the body, the brain has been removed and is always placed in a formalin fixation, that's formaldehyde, for preservation. The brain cannot be further cut and examined until it's preserved and solidifies somewhat. So President Kennedy's brain was placed in a bucket in a formalin solution, 10% formalin solution, 10% formaldehyde, and it was preserved by two methods at the same time. One method was the soaking, called exfusion, and the other method was called infusion. There was a drip created, and formaldehyde was fed into the brain. The brain was placed into the bucket upside down. Formaldehyde drip was let into the brain through a tube into the remaining arteries in the brain. So that combined technique was called perfusion. And that's the technique used to preserve President Kennedy's brain. Normally, there's one brain exam after the autopsy on someone's body. You're only going to examine a brain once because normally when you examine the brain, it's cut up like a loaf of bread. The so-called bread loaf incisions are called coronal incisions. They're made in this manner, from fore to aft, or from behind to the front. And the goal is to show bullet tracks in the brain, the pattern of damage. So once you conduct a brain exam one time, you can't do another one because the brain has essentially been cut up and destroyed. But what you do when you conduct the sectioning is you take pictures of each section. So that's the normal procedure. Most brain exams are conducted 1 or 2 weeks after an autopsy because it takes that long normally for the brain to fix and to become hardened enough so that it won't fall apart when it's cut. President Kennedy's brain was preserved by this joint technique called perfusion, both soaking and injected drip, so it was able to be examined sooner than it would normally have been. It was examined Monday morning, November 25th. We know that for a fact. What's disturbing is that my timeline analysis revealed that there was a second brain exam, supposedly of President Kennedy's brain. We know the authentic brain exam was on Monday, November 25th, the day of the funeral. It was conducted in the morning. The very reliable witnesses to that procedure are John Stringer, the photographer, and Dr. Boswell, who were consistent over the years with both the HSCA and the review board about when this was conducted. Dr. Humes was all over the place and kept changing his mind on when it was conducted, for obvious reasons. There was a second brain exam conducted, my timeline study showed, about a week later. Sometime between November 29th and December 2nd, the second exam was conducted. We know this because Dr. Fink recorded in his notes to General Bloomberg that Dr. Humes called me on November 29th and said the brain will be examined and invited me to participate. So we know the phone call took place on November 29th, long after the authentic brain was examined. Dr. Fink was called, come down and help us with the brain exam. We know that brain tissue was examined on December 2nd because of the recollections of Navy Chief Chester Boyers to the House Committee on Assassinations. So that exam, that second exam, took place between November 29th and December 2nd. There's something wrong with this. You can only examine somebody's brain once, especially if you conduct the coronal serial sectioning at the first exam. Dr. Fink was not at the first brain exam. Dr. Fink was at the second brain exam. The official photographer at the autopsy on the body, John Stringer, was present at the first brain exam. He took those pictures, including the brain sections, after each section was made. John Stringer did not attend a second brain exam, so an unknown Navy photographer took the pictures at the second exam. So here's a summary of the timeline. As I've said, the first exam was on November 25th. The second exam was conducted between the 29th and the 2nd of December. Now, I'd like to amplify this with a few comments. John Stringer recalled vividly taking each brain section after it had been cut, positioning it on a light box so that the brain section was illuminated from below and from above, photographing each section one at a time. So he took many photographs of brain sections. Before the brain was cut, John Stringer took images of the intact brain, but he only took images of the top surface, the superior aspect of the brain, the top of the brain. He did not take basilar views of the underside. The photographs in the archives today show no sections, no brain sections whatsoever. And the photographs in the archives show both superior views of the intact brain and basilar views taken from underneath. So the views in the archives show views that Stringer knows he did not take. And this collection in the archives does not show views that Stringer knows that he did take. Not only that, John Stringer recalled for us under oath, before he examined the photographs, he recalled the types of film that he used. He used a certain type of black and white film, Pan-X negative film for his brain photographs, and color positive transparency Kodachrome E3 film for his color shots of the brain. The brain photographs in the archives today are on the wrong kind of film. The brain photographs in the archives are taken on, the black and white film is Ansco, it's not Kodak. John Stringer used Kodak film for his black and white negatives. The black and white negatives in the archives are Ansco film, it's a different brand. Not only that, the black and white negatives in the archives are numbered 1, 2, 3, 4, 5, 6, 7, etc. John Stringer said that he used duplex holders. Duplex film and duplex holders is not numbered at the factory. It's not numbered. So the fact that the brain photos in the archives are numbered today indicates to John Stringer that they were taken using a film pack, one continuous roll of black and white negative film, which was later cut into individual negatives that are numbered. Furthermore, the color positive transparencies in the archives today of the brain are not on Kodak film, as John Stringer recalled using. They're on an unknown type of color film. The brand name is not on the edge print, and the film notches on each transparency are not the same as you would find on Ektachrome film. So John Stringer used Ektachrome film, which he knew had certain types of film notches in the corner that the photographer could feel in the darkroom, in the dark. And the notches in the film in the archive today are not the same notches you find in Ektachrome film. And it's not Kodak film like Ektachrome was. So this is courtroom evidence that would have the brain photos thrown out of evidence at any trial. They would not be admitted. Now this slide shows an artist's conception of what one of the brain photographs looks like. An illustrator named Ida Docks was hired by the House Select Committee on Assassinations. She made precise illustrator copies of this brain photograph and of the back of the head photograph for use in public hearings in 1978. So there are no bootleg photographs of the brain photographs, but we do know what one of them looks like from this artist illustration published in a House Select Committee report. This is a superior view of a brain. And you'll note that the right side of the cerebral cortex, the right top of the brain, is severely disrupted and looks like most of the mass is present, but it's been disrupted and it's outfolded off to the right. Significantly, you'll notice that the cerebellum is completely intact. Now, we reviewed earlier in this presentation the location of the cerebellum, low in the rear of your head. It was the red object in the skull model. You'll notice the cerebellum in this image is completely intact. In reality, it wasn't. 4 different Parkland physicians wrote in their treatment notes the day of the assassination that the cerebellum was severely damaged, macerated, torn, and that part of it was missing. Not only that, Dr. McClelland vividly recalls, even to this day, 50 years later, that as he stood at the head of the gurney while President Kennedy's treatment was ongoing, part of the right cerebellum fell out of the skull and landed on the gurney, onto the cart. That's a graphic recollection, but it's the kind of thing that none of us would ever forget. Dr. McClelland also testified to the Warren Commission in 1964 that he looked inside the wound after the president was declared dead, and in his estimation, at least 1/3 of the brain was missing. I repeat, at least 1/3 of the brain was missing. That was his estimate at Parkland Hospital. FBI agent Frank O'Neill told the review board under oath in 1997 that, in his estimation, when he saw the brain removed during the autopsy on the body, over 1/2 of the brain's mass was missing. Over 1/2 was missing. And after all, he saw more of it than Dr. McClelland did. Dr. McClelland was looking into an open wound and making an estimate. Agent O'Neill saw the brain as it was being removed and after removal at Bethesda Naval Hospital, and he said over 1/2 was missing. Frank O'Neill, during his deposition, said, and most of the mass was missing right here. He said, that's where it blew. Those were his words. That's the area of the right cerebellum and the cerebral cortex right above it, the occipital lobe of the cerebral cortex. Tom Robinson, the undertaker, told the review board during his interview in 1996 that a lot of brain mass was missing in this area, and he placed his hand on the back of his head. So these descriptions of brain damage by Frank O'Neill and Tom Robinson are entirely consistent with the Dallas wound descriptions from Parkland Hospital, and they're consistent with the observations of Clint Hill in the limousine. Dr. David Mantik, MD, and I both agree that President Kennedy was shot in the head 3 times, once from behind and twice from the right front. The shot from behind entered low in his skull. It was traveling at almost horizontally, so it probably came from the Daltex building. One of the 2 shots from the right front entered high above the right eye at the hairline, and it's my conclusion that it probably exited the upper left rear of the skull per the autopsy photograph. Dr. Mantik and I are confident that the second shot from the right front entered President Kennedy's skull just forward of and just above the right ear, right about here, and caused the large blowout seen at the rear of his head. I want to repeat that. The second shot from the right front entered right about here and blew out this area here. So it was almost a tangential wound. Dr. Kemp Clark, at the press conference following the president's death at Parkland Hospital, Dr. Clark, who was the head of neurosurgery, expressed the opinion that the head wound he saw may have been a tangential wound. In other words, it may have entered and exited at the same place. So if not a true tangential wound, it was almost the same, almost a tangential wound. This shot here that exited here probably came from near the corner of the stockade fence on the grassy knoll, either from the acoustic location noted by the House Committee, 14 feet from the corner of the fence, or possibly from the badge man location seen in the Mormon photograph. Somewhere near the corner of that fence, someone stood and fired the shot that struck President Kennedy here and caused this avulsed exit wound seen by everyone at Parkland Hospital. I believe that someone much farther down the fence line, from the area where the fence line meets the overpass, fired this shot, which entered here and exited here. So now that you've examined this simple schematic of where those 3 shots entered the skull, now that you've had time to look at that, let's summarize these conclusions. Okay. 1 shot from behind, entered low in the rear of the skull, probably did not exit. This would explain why the orbit of the right eye was cracked, the right eye was displaced, and the vomer was crushed, per Dr. Boswell's notes. The vomer is the bone in the middle of your nose. So the right eye was, the orbit was cracked, the vomer was crushed, and of course, no one saw any exit wound on the front of President Kennedy's face. So this shot probably stayed in the body, and this bullet was probably removed during the surgery prior to the autopsy. Another shot from the immediate right front came from near the corner of the stockade fence. And as I just mentioned, the second shot from the right front came from much farther down the fence line and entered high above the right eye. And it was this entrance wound that had to be excised during the postmortem surgery. That's why you have a large red incision, a large red V in the president's forehead right above his eye, which no one saw at Parkland Hospital. Let me emphasize the importance of that point. No one at Parkland Hospital saw a bright red triangle of bloody damage above the president's right eye. Nobody described anything like that. And in fact, the president's own wife, Jackie Kennedy, told the Warren Commission when she testified in 1964, "From the front, there was nothing." Quote, "From the front, there was nothing," unquote. And that she was holding his head down in the car after the shooting, trying to keep his head on. So surely if if there had been such a wound on his face, or for that matter, if the top of his head had been removed, or if the right side of his head had been removed, as we see in the Zapruder film and as we see in the autopsy photos, if the right side of his head had been blown out, she would have seen those things and she would not have made the statement she made. But Jackie Kennedy said, quote, "From the front, there was nothing," unquote. And no one at Parkland Hospital saw this bright red triangle. So my conclusion is that this bright red triangle we see in the autopsy photographs is an incision made to remove this third entrance wound discussed here, this entrance wound that was about the size of a dime right here in the hairline. That's my conclusion, that President Kennedy was shot twice in the body. I think this is something that most JFK researchers will agree with. We all know that President Kennedy was shot in the upper right thorax, in the back of his body, somewhere in the upper portion of his back. The Warren Commission decided to redescribe it as his lower neck, but that verbal plastic surgery was performed by Gerald Ford, but it was really in the upper right thorax, as described in the autopsy report. And that bullet was fired from somewhere behind him. No one at Parkland Hospital saw the entrance wound in President Kennedy's upper back. That's because they were hurriedly trying to save his life. They were dealing with the two major wounds that they were aware of, that they had seen, which was a gaping exit wound in the right rear of his skull and a small entrance wound in his neck just above the collar, just to the right of the midline, a small entrance wound right about here. So at Parkland, what happened was this. The president was laid on his back. The examining doctor, Dr. Carrico, did a quick physical examination for large cavities with his hands. He didn't feel any large cavities on the president's back. The clothes were cut and removed from his body with scissors and scalpels. They were quickly removed. The president remained on his back, and his back was not examined during the attempts to keep him alive. So the people at Parkland were not aware of the wound in the upper back. People at Parkland were aware of an entrance wound here, which had every characteristic of an entrance wound and no characteristics whatsoever of a wound of exit. This entrance wound in the neck is the second wound on the body that we know of. And this is the location where Dr. Perry, the emergency room surgeon, made an emergency tracheotomy incision right through the wound, a horizontal incision, very short, 2.5 to 3 centimeters, just below the Adam's apple, and just exactly where the wound was, right about here, so that a breathing tube could be inserted into the president's windpipe, and he could then be put on a breathing machine, because there was a blockage in the president's throat, blood and other debris, and he needed assistance in breathing. So the two wounds on the body are the back wound revealed during the autopsy and the entrance wound in the throat revealed at Parkland Hospital. Now, it's important to understand here that regardless of what Dr. Hume said about this later, that this truly was an entrance wound in the throat, another shot from the front. We know this because a press conference was held following President Kennedy's death at Parkland Hospital. The two doctors who answered the questions of reporters at the press conference were Doctors Kemp Clark and Malcolm Perry. Kemp Clark was the head of neurosurgery. Malcolm Perry was the emergency room surgeon who performed the tracheotomy. Malcolm Perry answered the question 3 times. 3 times during that press conference, he said, "This is an entry wound, a bullet coming from the front." He didn't know what the official story was going to be later. He described what he saw when he treated the president. And fortunately, there's a transcript that exists, a verbatim transcript of this press conference. The Secret Service denied that it existed when the Warren Commission asked for a transcript, but it exists. And in fact, the copy I have has a Secret Service time and date stamp on it. So the Secret Service later had to cough this thing up, and the archives ended up releasing it. So this is White House transcript 1427C. There was a stenographer named Wayne Hawks, who was traveling with the presidential party to Texas, and he sat there with his stenotypist machine and made the transcript as the reporters asked the questions and the doctors provided their responses. So 3 times Dr. Perry verified that this was an entrance wound in the throat. And then various doctors verified this, various Parkland physicians verified this in their treatment reports that they wrote that day. By the time they were interviewed under oath by Arlen Specter in the spring of 1964, Dr. Humes and the Navy had decided that they wanted this to be an exit wound, and Arlen Specter did all he could to get several Dallas doctors to say that this might have been an exit wound. To a man, these people either said it could have been either, they copped out, in other words, under pressure, or they very reluctantly agreed to his many stipulations and his loaded leading questions. But what matters the most are the statements made the day of the assassination by Dr. Perry and the treatment notes, the treatment reports written the day of the assassination by the treating physicians. And all of those written statements say this was an entrance wound, a third shot from the front. So let's summarize. The shot from behind has an uncertain origin. All that we really know about the shot from behind is that the wound, when examined at the autopsy, was very shallow and, in fact, did not even penetrate the lung cavity. So the pleura, the membrane that surrounds your lung cavity, was not punctured at all by this very shallow wound. At the same time, the autopsy pathologist expressed great puzzlement and frustration that they could not find any bullet in the body inside this wound. They had a very short bullet track, which Dr. Humes could feel with the end of his small finger, and which was probed by Dr. Fink. And the probe, both probes, the finger and the metal probe, did not reveal an exit wound anywhere else in the body. And in fact, as I said, the pleura was not violated. So the absence of a bullet in this shallow wound was a real mystery at the time of the autopsy, or so Dr. Humes professed it to be. There are reasons to doubt Dr. Humes' apparent puzzlement as to where's this bullet, and there are 2 reasons. Paul O'Connor was dismissed from the morgue during the autopsy proceeding at one point. He was uncertain of when, but he was dismissed. He was under guard, placed under guard by a Marine in the hallway. He wasn't allowed to go anywhere. About 40 minutes later, when he returned to the morgue, one of his colleagues who had stayed in the morgue told him that he had missed some procedures, and that one of the procedures that he missed was that the doctors removed a large fragment of a bullet from the intercostal area. Well, the intercostal area is the muscles between your ribs. And so think about what this means. One of the men in the morgue witnessed one of the autopsy pathologists remove a large fragment of metal from between the ribs and said there was a lot of bleeding in the intercostal area. And yet at the public autopsy performed by Dr. Humes between 8 and 11 p.m. later that night, he professed great puzzlement and frustration that he could find no bullet in the body. But what Paul O'Connor was told by his colleague puts the lie to that. And in fact, another enlisted man, Gerald Custer, one of the X-ray technicians, said in numerous interviews, as well as under oath, that as he was positioning one of his X-ray cassettes underneath the body of the president to take one of the chest X-rays, that a piece of metal fell from the president's thorax onto the table, onto the examining table. And that one of the doctors present reached forward with a set of forceps and picked it up. So we have 2 enlisted witnesses, 2 enlisted men, who told the truth years later, that there was evidence of some piece of metal in the body from the bullet that struck the president in the back, but that evidence has simply disappeared from the record, that's all. I'd like to talk a bit about the entrance wound in the throat, item number 2 on this slide. Many assassination researchers today believe that shot was fired from the south grassy knoll. In other words, the grassy knoll opposite the one where the headshots came from. The faraway grassy knoll, way off to the left of the limousine. That's the south grassy knoll. Many researchers believe that shot came from the south knoll and that it penetrated the windshield, that it's the bullet that created the hole in the windshield, that's the bullet that entered the president's neck and did not exit his body. You'll recall, anyone who's seen the Zapruder film, you'll recall the president reacting sharply to a frontal stimulus. And that's clearly him reacting to a frontal shot, this shot right here. Most researchers now believe it came from the south knoll, off in this direction to his left. That bullet did not penetrate the body. Dr. Clark, the attending neurosurgeon during President Kennedy's treatment, told a New York newspaper the weekend of the assassination in an interview, he told the New York Times, I believe it was, that he thought that bullet ranged downward into the chest and did not exit the body. So based on what they saw at Parkland Hospital, they did not see an exit wound for this entry. So we have a puzzle. Dr. Humes writes in the autopsy report, the version that survives today, that there was a large bruise inside the upper chest on the right side, and the bruise was on top of the pleural dome, right on top of the right lung, such that, as Dr. Humes explained during his sworn testimony before the Warren Commission, such that after the lungs had been removed at autopsy, the inside of the chest had to be illuminated, and then photographs were taken of this bruise on top of the pleural dome, which would have been right on top of the top portion of the lung. In Dr. Humes's mind, he claimed that this was evidence of the passage of a bullet from behind, through the neck, and out the front. That's utter nonsense, but that's what he claimed at the time, and that's why he said he photographed the bruise. He considered it important at the time. I believe the bruise is not evidence of a transiting bullet from behind. The bullet from behind didn't transit. It was going downward at a sharp angle, and the two autopsy technicians, Paul O'Connor and James Jenkins, both remember that the probing of this shallow back wound. They remember seeing the probe pushed and making a dent in the pleura after the lungs had been removed. And they remember that the indentation in the pleura from the probing of this shallow wound were somewhere below the heart, actually at the level of the descending aorta, such that if that bullet had continued to travel in a more or less straight line, it would have exited at or below the heart, and it certainly could not have gone through anyone's neck. So it's possible, in my view, that this bruise on top of the right lung, if that's really where it was evidence of a shot from the front, striking the president in the neck, being deflected by the tracheal rings. The tracheal rings were damaged, being deflected and going downward in his chest, as Dr. Clark had speculated, and then coming to a stop. A bullet which had transited the car's windshield would have lost a lot of momentum, a lot of velocity would have been lost. And that could explain why it would enter, be deflected by the trachea, and then go downward in the chest and stop. So that for many years was my speculation on the cause, for the real cause for the bruise on top of the pleural dome. What's interesting today is that this photograph is missing from the official collection. I now think I understand why, and it's a completely new interpretation of this part of the evidence that I've never written about before. One of the two enlisted autopsy technicians, James Jenkins, spoke at a JFK Assassination conference in Dallas on the 50th anniversary of the assassination. This is last November, 2013. James Curtis Jenkins, a very shy and retiring man who does not enjoy publicity at all, finally came and appeared at a research symposium and answered people's questions. He said he did not remember any bruise on top of the pleural dome. He remembered seeing a bruise on the middle lobe of the right lung itself. Now think about this. He remembered seeing a bruise on the middle lobe of the right lung. If that's the truth, then that bruise would line up with the shallow back wound. you see. The shallow back wound, which Humes claimed there was no exit for, was traveling downward at a steep angle. The FBI agents heard Dr. Humes say this. In fact, they recorded in their report that Dr. Humes said at the autopsy that the back wound was going downward at a 40 to 60 degree angle. No building was really that tall in Dealey Plaza, but that would have been the pathologist's estimate at the time. They recorded what he said. That type of trajectory, going steeply downward from a wound entering the back, could very well be the cause of a bruise on the middle lobe of the right lung. I tend to believe James Curtis Jenkins on this score. And I tend to not believe Dr. Humes. I think what was really photographed at the autopsy was a bruise on the middle lobe of the right lung. And I believe the reason the photograph is not in the collection is because Dr. Humes later lied about the bruise. I believe he lied about it in the autopsy report and changed its location, saying in the autopsy report the bruise was way above the tip of the right lung on the pleural dome. I no longer believe there was such a bruise on top of the pleural dome, way above the top of the right lung. I believe Jenkins, the bruise was in the middle lobe of the right lung, and I believe that's what was photographed, and I believe that's why the photograph of the bruise is missing from the collection, and I believe that Humes' statements that the bruise was much higher in the autopsy report are simply a fiction. This is an image of the back wound. There are so many questions about this wound that they will never be answered unless there's an exhumation of the president's body. If there ever is such an exhumation, it may not take place for many decades until a lot of the emotions surrounding this subject have attenuated. But some of the questions people have, is that the actual wound we see near the top of the ruler, off to the right of the ruler? Or is it the other dark spot below the big dark spot? Is the real wound underneath the ruler, and is someone hiding it for some reason? We could never get any of the autopsy pathologists to explain why there was a ruler in this photograph. No one could explain why. I found that rather strange. Unless there's an exhumation, we'll never really know if this is the wound described in the autopsy report. We need to move on to the throat wound because the throat wound was also the subject of tampering at Bethesda Naval Hospital prior to the beginning of the autopsy. Now, this disturbing image is the so-called stare of death photo. You can see that it's taken early that night because the president's head is in the metal head brace. You can see the bar for the metal head brace off to the left. You can see the fresh towel that's been placed underneath his head and shoulders. And the wound in this image is a horrible-looking gash. It bears no resemblance whatsoever to the incision made by Dr. Perry. Now, Dr. Crenshaw, a third-year resident who was present in Trauma Room 1 at Parkland during President Kennedy's treatment, he was interviewed in depth by ABC News in 1992 for a big news story. And one of the things he had to say was that when he looked at this autopsy photograph, in his opinion, someone had tampered with this wound and greatly expanded the size of the tracheotomy incision. He said he had never seen a tracheotomy incision that big in his life. He said Dr. Perry was a master with the blade and made a very, very small incision. When David Lifton interviewed Dr. Perry in the 1970s, Dr. Perry told him that the incision was only 2.5 to 3 centimeters wide. In the autopsy report, Dr. Humes describes this incision as 6.5 centimeters wide, and yet in his sworn testimony in 1964, Dr. Humes said this gash was 7 to 8 centimeters wide, really enormous. And in the autopsy report, Dr. Humes says it's 6.5 centimeters wide and it has widely gaping irregular edges. Dr. Crenshaw said in the news piece in 1992 that after the breathing tube was removed from the president's neck following death, the small incision closed of its own volition and was a neat, small, horizontal incision no wider than 3 centimeters at the most. And it had closed. So, based on Dr. Crenshaw's recollections, and based on what we see in this photograph, this wound has been severely tampered with. The purpose would be twofold. One would be to try to obtain access to whatever bullet went in from the front and remove evidence of a shot from the front. That was the whole purpose of this surgery prior to the autopsy, was to remove evidence of shots from the front. So this would have been along that same line of thought. In addition, enlarging this wound to try to obtain access to the bullet would have had the added benefit to the people doing the cover-up of making this look like an exit wound. Because right now, except for the possible hint, you see the hint of an entrance wound at the bottom of the gash. You see, it looks like part of a small, possibly part of the small actual wound of entrance. Most of it is just a large, unformed gash. And indeed, the final version of the autopsy report, the one in the archives today, claims that this is an exit wound, that it's not an entrance wound. Now we have some other evidence related to this wound, and that is the artist's illustration made for Quentin Schwen by a medical illustrator this past year. You'll recall that this is the best recollection Quentin Schwen has of the color transparency shown to him in 1982 or 1983 during a recruiting pitch by the federal government. Not only does this image depict an entrance wound above the right eye, but it depicts a different stage of tampering for the throat wound. Quentin Schwen described this eloquently to me during many interviews on the telephone. What is shown here by the artist is that he recalls a vertical incision bisecting the horizontal incision. So when the body left Parkland Hospital, President Kennedy only had a short horizontal incision which had closed after the trach tube was removed. Quentin Schwen remembers seeing a transparency with a vertical incision at 90 degrees to the horizontal one, which bisected it, and he said the vertical incision was actually longer than the horizontal incision, and that the four edges of the skin flaps had been peeled back. Just like if you cut a cross shape into an orange, you could peel back the skin of the orange to try to see what was underneath. He vividly remembers this. So what I conclude we're looking at here is an interim stage of this tampering. So the Dallas observations were an entry wound in the throat, about 5 millimeters wide, very small. This, I believe, is an interim photograph showing what the wound looked like after a first stage of tampering or investigation, and then the large, unseemly gash that we have in the existing autopsy photos is the final stage of the alteration when the butchers got done with their work. So to conclude, I believe 5 shots definitely hit President Kennedy from 3 directions. 2 shots from behind, 1 shot from the left front, and 2 shots from the right front of the limousine. This constitutes undeniable evidence of crossfire and therefore of conspiracy. There's an important point I'm trying to make here. Once a researcher crosses this threshold and is convinced that there was a conspiracy, you need to get out of Dealey Plaza and focus on the cover-up. Continuing to obsess over the details of what happened in Dealey Plaza, because the complete story can never be known, reduces the assassination to a parlor game and trivializes it. Studying the cover-up and how quickly it was implemented and by whom reveals that America experienced a coup d'etat in 1963. So the proper question, once you believe there was a crossfire and therefore a conspiracy, the proper question then becomes, why was JFK removed from office? And I'll be covering this at the end of this presentation. Many people do not know that the autopsy conclusions following President Kennedy's death were quite malleable during the first 2 weeks after the autopsy. They were changing. They were being revised very quickly. Most people don't know this. There were 4 sets of conclusions that we can identify in time. And I'm going to explain what those were below, but the implications should be very disturbing. Truth was not the only client. If it was, there would have only been one set of conclusions. The fact that there were 4 sets of conclusions, each different from the other, indicates that the people behind the cover-up were trying to decide what they could sell to the American people and to future investigations. That's all they were concerned about. So let's talk about these 4 sets of conclusions. The first set of conclusions was reached before 11 o'clock p.m., before the FBI agents left the morgue. We know that because these conclusions were recorded by the 2 FBI agents in their report. The report dated November 26, 1963, the Seibert O'Neill report. The conclusions grandly announced by Dr. Humes to the entire morgue audience and the FBI agents were that the pattern was clear. The president was hit twice from behind, once in the head from behind, and once in the back, and that the back wound did not transit the body, and that that bullet must have fallen out onto a stretcher at Parkland Memorial Hospital during cardiac massage while President Kennedy was being treated. Let me repeat that. Dr. Hume's initial conclusion during the autopsy was that the bullet that entered the back did not exit the body. At least this is what he told everyone. And that that bullet must have fallen out of the body onto a stretcher in Dallas, because the agents at the autopsy did receive word that a bullet had been found on a stretcher in Dallas. It was unclear what stretcher at the time. So they reported this to Dr. Humes, that a bullet had been found on a stretcher. This provided a convenient explanation for him before 11 o'clock at night for what happened to this bullet that caused this shallow back wound. And so this is what he announced to the morgue audience. Within 30 minutes, this set of conclusions had changed. The FBI agents left the morgue at 11 o'clock, and they proceeded to the FBI lab with the 2 small bullet fragments from the cranium, very small fragments. While at the FBI lab, they dictated a report, a telegram, to the Baltimore field office, which was later released as a telex that night. But the FBI agents left at 11. A second set of conclusions was reached by 11:45 p.m. Let me explain how this came about. Dr. Humes finally made telephone contact with Dr. Perry in Dallas shortly after the FBI agents left. We know it was after they left because if he had called Dr. Perry before the FBI agents left, they would have recorded that fact in their report. They recorded no phone call to Dallas in their report whatsoever. So therefore, that phone call took place shortly after they left. We know it took place that night for a number of reasons. Dr. Ebersol, a radiologist, when he testified to the HSCA, said he recalled the phone call to Dallas by Dr. Humes. And he had estimated that it was about 10:30 at night, and then later in the deposition he said, or later. So he remembered it taking place, and he remembered it taking place Friday night from the Bethesda morgue. Dr. Perry, the emergency surgeon who had performed the tracheotomy on President Kennedy, came back to work on Saturday morning, and Nurse Audrey Bell, the chief operating room nurse, said to him, "You look like hell. You must not have gotten any sleep." And he told her at the time, "I didn't get much sleep because they were on the phone all night long from Bethesda, badgering me, trying to get me to change my mind about the entrance wound in the throat. They wanted me to say it was an exit wound." So we learned this from Nurse Bell when we interviewed her in 1997, and it's on the audio tape that's in the National Archives. You can listen to it. You can listen to it for yourself. It's a pretty damning piece of information. So we know from the Perry statement and from the Ebersol statement that there was a phone call to Dr. Perry from the Bethesda morgue Friday night during the autopsy. A third indicator that there was a phone call with Dr. Perry Friday night is Dr. Perry himself. He testified before the Warren Commission more than once. And in some of his testimony, he indicated that he thought there was more than one call to Dr. Humes and that it was on Friday night Dr. Humes' story was that I only called Dr. Perry once and that it was Saturday morning. So Dr. Perry recalled more than one call, and he recalled it as being on Friday night. So there was definitely a call between Dr. Humes and Dr. Perry Friday night. It almost certainly occurred right after the FBI agents left the morgue. And this is when Dr. Humes learned that there was a bullet wound in the throat. And this must have caused tremendous consternation amongst him and everyone else intent on executing the cover-up, because they had just announced a two-hit scenario to the FBI agents. 2 shots from behind only, and no bullet transited the body. One bullet entered the back and fell out of the body during chest massage. That was one conclusion by Dr. Humes. The second bullet entered the back of the skull and exited the upper right side of the skull. That was the second Dr. Humes conclusion. But to learn from the Dallas surgeon who treated the president that there was a bullet wound in the throat created a major problem for the people at Bethesda. Some very disturbing things happened between this phone call and 11:45. Tom Robinson, the mortician, recalls seeing the pathologist insert a long metal probe low in the back of President Kennedy's skull, very low in the back, and having the probe exit from the tracheotomy site. In other words, someone made a forced passage with a metal probe to try to prove a bullet that entered low in the skull and transited the front of the neck. They had to make this into an exit wound to support the lone assassin scenario. That was clearly the orders that Humes and Boswell were operating under. So Tom Robinson recalls this probe being used and told the review board about it in 1996. Similarly, verifying what Robinson told us, Dr. Humes told his neighbor over the fence, his neighbor who is a CBS executive, that there was one x-ray taken of a metal probe going through the neck, which went in various directions and bent up and down, but which came out the front of the throat. And there is no such x-ray in the collection today. There is no such x-ray. I think the reason for that is obvious. It's anatomically impossible, really, almost impossible for that to have happened, for a bullet to have entered low here and to have gone through the foramen magnum, bounced off a vertebrae in just the right way so that it would have come out the front of the front of the neck without shattering the neck vertebrae. I mean, it's a virtual impossibility. But that night, that wasn't the way people were thinking. Someone inserted a probe low in the president's skull, made a forced passage, brought it out the front of the neck, made an x-ray of it. Dr. Humes talked about the x-ray to his neighbors, and in fact, here's a picture of the document. Once again, this is the famous CBS memo in which Dr. Humes also talks about this x-ray taken of a probe coming out the front of the neck. There is no such x-ray in the collection. Someone obviously decided later that it wasn't believable and removed it from the collection. They culled the collection. So what all this means is that Dr. Humes and his colleagues were struggling with a way to explain what Dr. Perry described on the phone as an exit instead of an entrance. And I conclude that by 11:45, they had succeeded. And I'm going to tell you how I came up with that time. General Wheel's aide, Lieutenant Lipsey, remember, General Wheel was the commandant of the military district of Washington. His aide, Lieutenant Lipsey, was interviewed by the HSCA in 1978. Richard Lipsey drew a diagram of a 3-shot scenario that he heard Dr. Humes proclaim to the morgue audience, and drew a diagram of it and explained it in great detail to his interviewers from the HSCA staff. That one bullet had entered the back of the head and blown out the right front. That was bullet 1. Bullet 2 had gone in low in the rear of the skull and come out the neck. That's Lipsey's bullet number 2. Lipsey's bullet number 3 was a shallow back wound that went in the back, didn't go anywhere, and there was no bullet found in the body. So these are the 3 hits that Lipsey heard Dr. Humes describing. The FBI agents never heard a 3-hit scenario described by Dr. Humes. They were professional observers and they took notes. They heard a 2-hit scenario. So the fact that Lipsey overheard a 3-hit scenario and could describe it with great confidence in 1978 means he heard the new explanation that Humes came up with sometime between 11:05 and 11:45. And the reason I say that is at 11:45, the body was turned over to the Gawler's funeral home for embalming. So at 11:45, the doctors took their hands off the body, and there were no more activities by them on the body of JFK. So sometime between that phone call with Perry at 11:05 and 11:45, when the body was turned over to Gawler's, Humes concocted this new explanation. And you'll recall that I've already told you that the first draft of the autopsy report was burned by Dr. Humes in his fireplace on Sunday. That first draft, interestingly enough, was reviewed at Bethesda Naval Hospital on Saturday by Dr. Humes and Dr. Boswell. Dr. Fink was pointedly not invited. That's interesting to me. He was not invited. John Stringer, the official photographer, told me after his deposition was concluded that the reason the doctors did not invite Dr. Fink to the first brain examination was because, quote, he caused too much trouble at the autopsy, unquote. That was John Stringer's opinion for why Dr. Fink was not present at the first brain exam. It was a very revealing statement. So what we had was Dr. Humes and Dr. Boswell, who were not forensic pathologists. They were just pathologists. Dr. Humes was a forensic pathologist. He was trained to obsess about entrance wounds and exit wounds on the body. That was his sole function that night, and in his mind, and his sole focus was to find where are the entrance wounds and exit wounds. And when he couldn't find entrance wounds and exit wounds in the skull, that's when the Secret Service brought in extra skull fragments, which they said had been found in the limousine. Now, Dr. Fink was trained as a forensic pathologist. He was qualified to study forensic causes of death, bullet wounds, stabbings, machete cuts, things of that nature, and come to the proper medico-legal conclusions. Doctors Humes and Boswell were not forensic pathologists. They were just ordinary pathologists. Much of the tissues they examined were just tissue samples or tissue sections and slides made at someone else's autopsy. Or autopsies that they performed when they were younger were autopsies on people who died through disease, not through gunshot wounding, not through stabbings. So Dr. Fink was a forensic pathologist. His sole focus the night of the autopsy was entrance wounds and exit wounds. And he made such a stink about it that at one point the Secret Service felt compelled to bring in these 3 skull fragments. And they actually used the words when they presented them to Dr. Humes in this charade in front of this audience. They said these were removed. They used the word removed. They didn't say they were blasted out by a bullet. They said these were removed. And the FBI agents wrote that language in their report, that the 3 skull fragments were brought in. Dr. Humes was instructed by the Secret Service that they had been removed. That's really interesting language. As John Stringer told me, it was his opinion that the reason Dr. Fink was not invited to the brain exam of President Kennedy's brain was because, quote, he caused too much trouble at the autopsy, unquote. Now this tells me that Dr. Fink, who is a board-certified forensic pathologist, was a meticulous professional and was obsessing, as he should have, over entrance wounds and exit wounds during the autopsy, and was dissatisfied, which is why the other 3 fragments were brought into the room by the Secret Service when Dr. Fink was unhappy. I think this same personality trait of Dr. Fink, this same tenacity of his obsession with the basic facts, is one reason why he was not invited to review the first draft of the autopsy report on Saturday. Well, we know from the review board's deposition of Dr. Boswell that Boswell and Humes met at Bethesda Saturday, late in the morning, and reviewed the first draft of the autopsy report. Dr. Fink was not there. So I think we know why. He caused too much trouble at the autopsy, per John Stringer. That first draft, however, was reviewed by Captain Canada. This is the same Captain Canada, I've discussed earlier. He reviewed the first draft, and undoubtedly others did as well. I'm sure Admiral Galloway looked at it. He was the head of the entire complex, and probably Captain Stover as well. But in the letter of transmittal for the existing autopsy report, it states that Captain Canada reviewed the first draft. Someone Saturday found that draft unacceptable. Now, it's always been my assumption, and it still is today, that the content of the first draft was the three-hit scenario that Richard Lipsey recalls hearing. He recalls hearing it, obviously, shortly after the FBI agents left the morgue and after the phone call with Dr. Humes. He recalls hearing it, probably at about 11:30 or 11:45. And this was undoubtedly the content of the first draft. Someone found it unacceptable Saturday. We know from the work of the HSCA that Dr. Humes went home Saturday afternoon and Saturday night, he struggled for several hours and rewrote the autopsy report. And then, by his own admission, he burned in his fireplace the first draft on Sunday morning. I think I know why the authorities at Bethesda rejected the first draft of the autopsy report. The official story was that there were 3 shots fired that day. And everybody knew that Governor Connolly had been shot. And everybody knew that President Kennedy had been shot in the head and shot in the back. That's what the world knew at that time. So that's 3 shots. I think someone Saturday said, uh-oh, Governor Connolly was shot too. You can't have all 3 shots hitting President Kennedy. I think that's what happened on Saturday. So the 3-shot scenario was rejected. And Dr. Humes wrote another version of the autopsy report, as I said, Saturday night, and he burned the first draft on Sunday. Now let's talk about the next version. The next version is item 3 on this slide. And the scenario has gone from 3 hits from behind back to 2 hits. So President Kennedy, who Humes announced late Friday, was hit by 3 shots, and which he put in the first draft. It's now back to 2 hits. And I think I know the contents of this first signed version. I think I've figured out what the contents were of this second written version of the autopsy report. By the way, this is the signed version that the Kennedy family never returned to the U.S. government. This would be the signed autopsy report signed by Dr. Humes that was mentioned in paragraph 9 of the Dr. Berkeley inventory in April 1965, which disappeared into the custody of the Kennedy family and was never returned to the government for whatever reason. So this first signed version, I believe, said the following. 1 shot to the head, a bullet from behind, low in the head, exiting somewhere up here. A shallow back wound again, shallow back wound that did not exit the body. And I believe it said that the wound in the throat was caused by a fragment from the headshot. We have good evidence for believing that that's how Dr. Humes dealt with the wound in the throat problem. Remember, he talked to Perry on Friday night. He had to explain this in some way because the Dallas doctors had seen it and they were going to be talking about it and testifying about it eventually to various investigations. So the evidence we have that Dr. Humes tried to explain this away as a fragment from the headshot coming out the front of the neck is from the chief counsel of the Warren Commission, J. Lee Rankin. And this is from an executive session transcript, which at the time was classified top secret. This executive session transcript from January of 1964 is Rankin meeting with the commissioners. I believe it was for the first time. And he's saying, we have to figure out how to deal with this throat wound, in so many words. And he says, because it says here in the autopsy, he uses the word autopsy. He doesn't say autopsy report. He says, it says here in the autopsy that the throat wound was caused by a fragment. So what did he mean by that? Well, there were 2 newspaper stories in December of 1963, one in Philadelphia and one in Washington, and they both mentioned that the throat wound in the front of the neck was caused by a fragment from the headshot. So the confluence of these reports, the two newspaper stories, which are an official leak of some kind from somebody in the government to the media, they wanted the public to believe this. The confluence of the two newspaper stories that this hole in the neck was caused by a fragment from the headshot, and J. Lee Rankin's comment in a private session of the Warren Commission in January that it was in the autopsy that it was caused by a fragment, that leads me to this conclusion, that the contents of the first signed version were one shot in the head from behind, one shot in the back, shallow wound, no transit of the body, and a fragment from the headshot caused this hole in the neck. And I don't think that autopsy report survived very long for the following reason. Shortly after Monday, November 25th, now this report would have been the one that was signed Sunday. The missing signed version, in my view, has to be the autopsy report signed on Sunday, the one the doctors talk about in their testimony. It's the signed version we don't have anymore. And the reason I think this didn't survive more than 2 or 3 days is because everybody started watching the Zapruder film. Everybody in the government after Monday the 25th, copies of the Zapruder film started to proliferate. The FBI borrowed a copy from the Secret Service, and then they made second-generation copies from it. And then the Secret Service had its copies, and everybody was starting to watch the Z film. And the Z film clearly shows the president reacting to a frontal stimulus, to a wound of some kind in his neck, long before the headshot. Long before the headshot. In fact, he begins reacting to the frontal stimulus in frame 225 when the car emerges from behind the road sign. So that's why that autopsy report didn't survive very long. And so the final item on this slide here is the autopsy report we have in evidence today. The extant autopsy report, Commission Exhibit 387, is also a two-hit scenario. This one, however, posits the one shot to the head from behind and a shot in the back, which suddenly, miraculously, is said to have transited the body for the very first time. This is the very first time this final version of the autopsy conclusions, the fourth version of the conclusions, the third written version, is the one that says a bullet in the back transited the region of the neck, came out the front of the neck, creating this exit wound. Months later, Arlen Specter and Dr. Humes together invented the single bullet theory, saying that that's the same bullet that hit Governor Connolly. But initially, this concept of a transiting bullet that went through the upper back, somehow went through or around the neck without damaging it, and then came out the front of the throat, that concept is first written down in the third written version of the autopsy report. So there's no reason we should have any confidence in it. In fact, the stories that surround the nature of the throat wound are really remarkably varied. Let me tell you what I mean by that. Dr. Fink, who testified before the Shaw trial in New Orleans in 1969, I believe, said that the autopsy surgeons were prohibited from probing. They were told not to probe the incision in the throat by someone of a very high rank during the autopsy. They were directed not to probe the throat wound or the tracheotomy incision. They were told not to probe it. That's one story that comes from the pathologist. Another story is Dr. Boswell, who is telling, I think, the closest version to the truth, the closest version. Dr. Boswell told both the HSCA staff in the late 70s, and he told the review board that, oh yes, he said, we realized we had an exit wound in the throat by the end of the autopsy. That's a very interesting statement because it's in conflict with what Dr. Humes always said on the record. Dr. Humes always said that there was no phone call to Dr. Perry on Friday night, that he didn't call Dr. Perry until Saturday morning. We know now that's not true. Dr. Perry said it wasn't true, Nurse Bell said it wasn't true, and Dr. Ebersol said it wasn't true. Dr. Humes claimed in his testimony before the Warren Commission that Saturday morning, when he called Dr. Perry, it was only then that he learned there had been a wound of some kind in the throat. And it was then Dr. Humes claimed that he had this aha moment where he connected the dots of entrance wound in the back, bruise on top of the right lung, gash in the throat, and he purportedly, supposedly went, aha, and the light bulb came on, and supposedly after he's relinquished the body, after he has given up any chance of finding this magical bullet track, he decides that, okay, that bullet that went in the back transited the neck and came out the front. So when you have three people who can't keep their story straight, it means that the official story isn't true and that they're all lying, or at least two of them are. Dr. Humes told us that there was never any attempt to probe the throat wound during the autopsy because he didn't think it was a bullet wound. He was appalled. He said he thought it was a horrible-looking incision. They'd never seen one that bad, and the enlisted men at the autopsy said it looked like a big old gash, and nobody had ever seen a trach that big or that wide or that badly done. But Humes claimed we never tried to probe it, and yet Dr. Fink said under oath at the Shaw trial that they were told not to probe it. So, at this point, do we really have any reason to believe that there really was a bruise at the top of the pleural dome above the right lung? I no longer have any reason to believe that. I think the bruise on top of the pleural dome above the top of the right lung is something Humes made up out of whole cloth when he rewrote the autopsy report for the last time. I think there was probably a bruise in the lung area, but it was probably in the middle lobe of the right lung, like James Jenkins revealed last November. And if so, then that bruise would have been where the bullet that entered high in the back, that would have been where that short round, where that bullet stopped. So, summarizing here, we've got 4 conclusions about the autopsy wounds that are reached before December 11th. That's a pretty rapid transformation of conclusions. We know that on December 11th, the final version of the autopsy report, the one that exists today in the archives, was taken to Dallas by Secret Service agent Elmer Moore and was shown to all the Dallas physicians who had been in treatment room 1. They were told to read it. This was the government's way of telling them, you're wrong. There was no entrance wound in the throat. It was a wound of exit. The bullet transited the body. And oh, by the way, the government knows that that's the bullet wound you missed in Dallas. You didn't know the president was shot in the back. That bullet came out the front of his throat. So you guys didn't know what you were totally doing and saying. And we're telling you, as the authority, the U.S. government, that you were wrong and that the wound in the throat was an exit. So by December 11th, when Moore took that report to Dallas and forced everyone to read it, by then these conclusions were finalized. And what's really amusing and interesting to me, and appalling really, is that in January 64, Rankin is meeting with Warren commissioners, and he still has an earlier version of the autopsy report in front of him, because that's when he says, we have here in the autopsy that the neck wound was caused by a fragment. He's talking about the previous version. So this is an amazing, almost a comedy of errors. And if it wasn't for the secrecy in place at the time, and the lack of openness in government, these people would not have gotten away with this. In fact, if there had been a trial, if the accused assassin had not been murdered, and there had been a trial, as I've said before, most of this evidence would not have been admitted into the courtroom by the judge. The autopsy report would not have been admitted because of the chain of custody problem with the body and because it was rewritten so many times. The autopsy photographs would have been shown to the Dallas physicians. The defense counsel would have asked all of the Dallas doctors and nurses if these were the wounds they saw on the body, and as soon as they said, no way in hell, that's not like anything like I saw, the jig would have been up. That would have been it. And then the defense counsel would also have called many witnesses from the autopsy, other than the pathologist. They would have called the enlisted autopsy technicians and the FBI agents, and this cover-up would not have succeeded if there'd been a trial. It would have been blown wide open. As it was, the Warren Commission got away with a fast one. They succeeded in never showing the autopsy photographs to the Dallas doctors and nurses. The key Dallas treating physicians and the key nurses that treated the president did testify under oath to the Warren Commission. Some of them did so in Dallas, and some of them came to Washington. None of them were shown any of the autopsy photographs. And so they had no chance to say whether these images did or did not comport with what they saw. The thing you need to understand is that when Jeremy Gunn was questioning Drs. Humes and Boswell under oath in 1996, he asked them if this wide series of autopsy shots, all the shots of the head and the head brace, he said, are these pictures taken before incisions or after you made incisions on the body? And both pathologists, both Humes and Boswell, said they were taken before we made any incisions on the body. So that's their official story. They're sticking to it, but we know now that that cannot be true. It cannot be true. The surgery was witnessed by Tom Robinson and Ed Reed, and Robinson, Berkeley, and Canada observed the same exit wound in President Kennedy's head that was seen in Dallas right after the body arrived. Therefore, the surgery took place at Bethesda. Case closed. Before we move on to the subject of the Zapruder film, I'd like to revisit one more time the importance of the back of the head photo, the famous or infamous photographs from the autopsy which appear to show the back of President Kennedy's head intact. As discussed earlier, there are many reasons not to have any faith or confidence in this photograph showing the back of President Kennedy's head intact. Those reasons include the observations of the Parkland Hospital treatment staff, the observations of Secret Service Agent Clint Hill, the observations of mortician Tom Robinson, the observations of Rear Admiral Berkeley, of Captain Canada, and of FBI agents Seibert and O'Neill. There is one other witness that I have not discussed yet, whose recollections were crucial in disproving this as a photograph that we can have any confidence in. The review board took 10 depositions, as I've mentioned, of autopsy participants or witnesses. One of those depositions was of former Navy Petty Officer Sandra Spencer, who was a first-class photographer's mate in the U.S. Navy at the time of President Kennedy's assassination. She was not at the autopsy. However, she did develop a lot of postmortem photography of the president taken after death. And she developed those images the weekend following his assassination. Sandra Spencer, in the opinion of Jeremy Gunn, our general counsel, was the most credible witness we had before us in the medical evidence arena, the most credible witness we had. That's a heck of a statement coming from Jeremy Gunn. I found her very credible also. Sandra Spencer described to us seeing numerous photographs of President Kennedy taken at the autopsy. She thought they were taken at the autopsy. When we brought her to Washington and took her deposition and showed her the autopsy photographs in the collection today, she visibly blanched and became disturbed. And she said, "He really looks beat up." She said, "I did not see the president in any condition that I see in these photographs today in the official collection." So we said, "Well, would you please describe what you did see?" She said, "Well, they were taken after death, but she said he was fully clothed and he was all fixed up and cleaned up. And I didn't see blood everywhere and I didn't see these wounds all opened up." She said, except for one. So she recalled one photograph that she developed of the back of President Kennedy's head, which still showed a huge chunk of matter missing from the back of his skull in about this area right here. Just about halfway up and maybe just to the right of the center. And she gave us some dimensions for, I think it was about 2 or 2.5 inches wide. But so what she was describing, you need to understand, was a defect in the back of President Kennedy's head that could not be closed even after the end of the embalming procedure. Because what she was clearly describing was that she had developed a series of post-embalming photographs taken of the president after he had been reclothed and after he had been cleaned up and fixed up. And so the fact that she recalled making numerous prints of this one photograph showing a hole in the back of the head after the embalming was completed proves that this image in the collection today cannot represent reality. It is either a rearrangement of scalp from elsewhere on the head, rearranged for just 5 minutes to take a quick set of deceptive photographs, or it's an altered photograph. Now, Dr. Mantic has been to the archives 9 times, as I mentioned, and he has done something that my boss and I never did during the days of the review board. Dr. Mantic has used stereoscopic viewing. So he has looked at this back of the head image with the stereoscopic viewer, and he has told me and has told others that that's the one image of the head in the whole collection that doesn't look right when viewed stereoscopically. He says that that middle portion of the back of the head in this controversial image does not look three-dimensional. It looks two-dimensional. And the rest of the head around it looks normal, looks three-dimensional. So based on Dr. Mantic's observations and his eloquent descriptions of what he saw in his interpretations, I now believe that he's likely correct and that this back of the head photo is most likely an altered photograph. He thinks it's probably a soft edge mat insertion. I don't know if that's true or not, but I think it's much more likely that it's an altered photograph than it is rearranged scalp. When I wrote my book, I thought the scalp had been rearranged from the left side of the president's head and that they just covered up the back of his head for the sake of taking that one picture. But now I tend to believe that Dr. Mantic's probably right. It's probably an altered image. And the proof of the pudding is the recollections of Sandra Spencer and her sworn testimony under oath that the photographs taken after the completion of embalming still showed a hole in the back of the head. And in fact, she's corroborated by the recollections of 2 other witnesses, Tom Robinson, the embalmer, and Paul O'Connor, one of the Navy enlisted men at the autopsy. Both said years later that when the embalming was completed, there was still a hole in the back of the head. It was covered by a rubber seal or a rubber dam. The scalp was sewn into the rubber dam, but that there was no scalp in that area, and that the hole could not be closed because there was no bone and no scalp, and that it was hidden by turning the president's head slightly to the right on the pillow. The president, they observed, was placed in the casket. His head was turned slightly to the right to make sure that that defect, which was still present, was not visible in case there was going to be an open casket funeral, because at the time they didn't know. They didn't know Friday night whether there would be an open casket funeral or not. So one of the reasons Sandra Spencer was considered such a reliable witness by Jeremy Gunn and I is because of her, not only because of her demeanor, her sobriety, but because of her former position. She had been detailed to the White House and worked for Chief Robert Knudsen, the Navy chief photographer's mate, who was sent there to be a social photographer. She worked for Chief Knudsen and basically developed all his pictures. So she would develop his social photography on almost a daily basis whenever the president and his family were in town. And she did so at the Naval Photographic Center across the river in Anacostia, a highly secure facility at the time. So she was a very trusted member of the inner circle of photographers who basically knew and saw everything. The social photographers who photographed the president and his brother and the family were privy to a considerable number of social secrets on occasions. They were able to keep their lips sealed and keep their mouths shut, and for that reason they were trusted. People like Robert Knudsen were highly trusted by Robert and John Kennedy, according to Knudsen's family. So the fact that Sandra Spencer worked with these people, photographed or developed the photographs for many important ceremonies and family functions is the reason why we held her in such high esteem. One final note, Sandra Spencer was in charge of selecting the images for the prayer card to be handed out at President Kennedy's funeral, and which were also mailed to thousands of other people. So she worked with the widowed First Lady on the selection of the most favored photograph. to use, and she personally designed the prayer card and ensured that X number of thousand copies were printed up the weekend before the funeral. So she was a very busy person that weekend, developing postmortem photography and the prayer card. So that pretty much says it all regarding Sandra Spencer and her trustworthiness. And the American people and the review board owe her a great debt.